Congress will consider for fiscal year 2010 will reflect some very difficult choices, as we know. These choices must be made in the face of an economic crisis and years of harmful cuts and inadequate funding for critical programs by the previous administration. Over the past 8 years, we have seen cuts to programs like the National Institutes of Health and the Centers for Disease Control, a war in Iraq that has cost the country hundreds of billions, if not trillions of dollars, and budgeting gimmicks that hid the true cost of a failed fiscal policy. Now, with a new administration and a new president, we have the opportunity to develop a budget that's both honest in our assessment of the country's finances and adequately reflects the need of our great country. The LIHEAP program is one of the most crucial support structures for millions of families throughout the country. Every winter, tens of thousands of New Hampshire households, over 40,000 each of the past 2 years alone, apply to our fuel assistance program for help with their heating bills. The committed people who run this program work long hours to deliver assistance to those who need it most. In 2006, the New Hampshire Fuel Assistance Program was able to provide an average benefit of $638 per applicant. In 2007, the average benefit fell to $533, obviously not enough. Last year, in the face of skyrocketing oil prices, Congress responded by fully funding the LIHEAP program, providing $5.1 billion. In 2008, thanks to Congress' work to increase funding for the program, the average benefit in New Hampshire is about $1,000. For the first time in many years, the program is able to provide a significant benefit. If oil prices go back up, fully funding the program will be even more important. If prices stay low, continuing to fully fund the program will mean that next winter a meaningful benefit can be provided once again. In the President's summary of his budget, $3.2 billion was set aside for LIHEAP. This is a welcome change from proposed budgets of years past, but it does not fully fund the program. As you begin work on the fiscal year 2010 budget resolution, I urge you to include full funding of $5.1 billion for the LIHEAP program. Too many people in my state and around the country rely on LIHEAP to keep their heat on or the houses cooled. There are many priorities that require Congress's attention in this budget process. As a member of the Armed Services Committee, I would also like to talk briefly about the services we're going to provide to veterans. This committee and this Congress have made great strides over the past 2 years in improving veteran services. The historic funding levels approved by this Congress are helping the Veterans Administration tackle some of the long-standing problems that have plagued the agency. Now, with President Obama and General Shinseki's pledges to increase funding for the VA and to improve VA benefits, our nation's heroes stand to see even further progress. I urge you to work with the administration and the VA Secretary to provide funding that will further reduce the backlog and wait times that our veterans suffer while waiting for their claims to be approved. I also urge you to increase funding for the Veterans Health Administration and to provide the resources so that the VA can deliver more care in communities throughout the country. I want to speak particularly about New Hampshire and a problem that we face. New Hampshire remains the only state in the country without a full-service VA hospital or access to a comparable facility in-state. This is simply outrageous and intolerable. New Hampshire's veterans have fought as bravely and as honorably as the veterans in every other state. We must keep our promise to them and to their families. We must give them access to full-service medical care in New Hampshire. I've been working to fix this inequity since I came to Congress 2 years ago, and I look forward to working with you to pass a budget that will give the VA the resources needed to provide more medical care to our New Hampshire veterans. We face incredibly difficult financial decisions that we must make over the next few months. While we must rein in spending where we can, these are 2 areas where I believe we must continue to invest. Again, thank you for the opportunity to appear before you. I look forward to working with you to pass a strong budget resolution that reflects the moral and the fiscal priorities of this Congress and those of the American people. Thank you very much.
And the gentlelady yields back the balance of her time. So let me take that time to ask you a question. Did you find that even with the LIHEAP program being funded at a more adequate level, that there were many people who did not meet the eligibility criterion for the program who suffered because of it?
Absolutely. There are many families that really should receive this, must receive it, but they don't fall inside the strict eligibility program. The other problem that we have is that many people never even applied. They have heard that the money's not there. They hear stories about how difficult it is, or they just don't even know, and so they don't apply. And one particular story that pushes me to keep fighting is a story of a young woman who was waitressing, and I went into the restaurant, and she recognized me, and she told me that they didn't have any money for heat for her 2 children, but they were getting used to it. And this was as the winter was coming on. You cannot get used to being that cold. In New Hampshire, with those temperatures, you can die from it. So this is really critical, and it is part of our moral responsibility when we look out across our great nation to reach out for those who, through no fault of their own, have not been able to simply heat their homes or feed their children, or those issues that make a budget a moral document. So I thank you again for the chance to talk
And
about this.
thank you so much for your testimony. The chair, hearing no objection, will announce that the committee will stand in recess, subject to the call of the chair.